All right, so here we have a patient that we were hoping we'd be able to do a 3, but upon examination, it's clear that we're not able to do a type 3 gynecomastia procedure. So he clearly has an excess of skin tissue. And the easiest way to determine that is simply to pinch skin and see how much skin that you can pinch. And you can see that it goes from there to there. So we've got a good, really 8 centimeters. That's not even close. On this side that we have, and this is really where I go with this, effectively between these two lines. So we've got a good 7 centimeters of excess skin. So we're going to be able to remove that skin, and also we're going to be able to reduce his areola. But what I'd like you to do is just imagine just removing the volume on this gentleman. And you can clear it. It's easy to see that you'd end up actually with a worse problem than you started with. It would just be completely deflated. So we're going to solve that. We're going to remove this amount of skin, tighten the chest skin, and he's going to have a tight chest for the rest of his life.